going to go to the phones. We have Beth on the line. How are you?
Good. How are you?
Fine, thanks. What's your situation?
My question is actually for the doctor. I have a 9.5-month-old son. He was circumcised in the hospital a day after he was born by my OBGYN, and I was told by the recovery room nurses to apply A&D ointment to the diaper area for 24 hours and then to leave it alone to let the air hit it. When I took him for his 1-week visit to the pediatrician, she told me that his penis had attached to the remaining foreskin, and that it would have to be retracted again manually. So she did that in the office, and the whole tip of his penis bled for about maybe 15-20 minutes, and then stopped. A scab formed, and it was fine. He didn't cry. There was no pain. I don't know. I just don't know what happened. When I took him for his 9-month visit 2.5 weeks ago, she told me that the tip of his penis had again reattached to the remaining foreskin. And all of his visits at 2 months, 4 months, 6 months, and now at 9 months, all she's told me is, my pediatrician rather has told me that, some OBs take a lot of skin, some OBs take a little bit of skin. My question is, I don't know what I need to do now for him. I don't know why friends of mine have had doctors who have told them to apply A&D ointment to the penis, wrap it in gauze for a week. I'm not sure what I did wrong. I don't know what's going on. I don't know if he's going to have to be recircumcised. I'm very upset. My husband is distraught. And we chose to circumcise him because his father is circumcised and because I believe that it's a health issue. And it was no question in my mind. I know it's painful. I know a baby cries. Babies cry when they have their heels pricked when they're, 2 hours old. And I feel good about the decision that I made. My concern is that he's not going to look like a circumcised baby.
Okay. There's a lot of difference in the way people treat the healing, do the post-op care after circumcision. It sounds like probably the best thing at this point for you would be to possibly go beyond your general pediatrician and possibly get a consultation from a pediatric urologist who specializes in this kind of problem. There's been some discussion about, quote, about people doing a mini circumcision. There's been some claims that when in ancient times, the circumcision done then was much less extensive, and they removed a lot less foreskin than they do now. Those have little archaeological or descriptive evidence to justify them, but that is sometimes a problem that we run into. Is I have seen babies that have had just a small amount of the rim of the foreskin removed, and these babies are actually at an increased risk for adhesion formation. I don't know, I'd have to examine your child to find out whether or not that's exactly what's going on, but adhesion formation, if not enough foreskin is removed, that actually increases the risk. So that's something you're going to, I really think that possibly seeing a pediatric urologist and seeing if there's something that needs to be done definitively to prevent adhesion formation is probably the wisest thing for your part. Again, this is a significant trauma in your life, but the callers in general and the people who are viewing the show have to recognize that things like this are few and far between. Circumcision is a procedure that has a very low risk, but it's not zero. Circumcision prevents some diseases, but they're rare diseases. These are things that have to be discussed on a cultural basis.
Well, Beth is comfortable with her decision. Right. I mean, I don't think that's the question. The question is, every time she goes back to the pediatrician, she feels like it's fresh hell. It's not working out.
I understand.
So I think your advice is very wise. Go to a specialist.
If I discuss this with my pediatrician, because of health insurance, the whole health insurance, needing a referral and things like that, and going back and forth 100 times to the doctor, do you think that what she told me at my last visit was, it's okay, it's going to correct himself as he gets older? I don't want to wait till he's 5 years old.
I think if you tell your pediatrician you want a referral to a pediatric urologist, you should get it.
Right, you should be insistent that you're very worried about this, and it's no reflection on her.
No.
Yeah, so best of luck. We are going to go next to Pam. How are you?
Hi, fine, thanks.
And your comment.
Yeah, I really just had a comment. I have a 2-year-old son, and my husband and I decided before he was born, he's a twin, so I might say they, we decided we did not want to circumcise him because we didn't feel that it was necessary, and we didn't want to put an infant through that kind of trauma. And we're happy with that decision. And I just wanted to make that comment that it's been no special cleaning issue. He's been perfectly healthy. It hasn't been an issue at all for us. And like other people have said in the past, it's just a matter of hygiene. And my daughter has to learn to clean herself properly, as does my son. My only concern is not him in any way. It's what other children may say to him, because he's going to look different from probably most, if not all, of the other boys when he goes to school. And I guess I'm glad you're having a show like this, because I wish that more people were informed about this. I think most of my friends do it just because everyone else does it, and it just doesn't make sense to me.
Right, right.
I want to address that a bit, because one of the problems in dealing with this issue, and I'm hearing it consistently with the callers, is the fact that how limited knowledge we have about the anatomy, and about how limited knowledge we have about the penis. And if you look at medical textbooks, if you look at biology textbooks, most of these textbooks show a circumcised penis. They don't show a penis that has a foreskin. So most people grow up and say, well, that's a normal penis.
Right.
And we need what No Circ is all about is educating and re-educating people the fact that this is a normal body part.
Right.
And
the foreskin is normal.
The foreskin is normal.
Okay, we're going to have to, one last thing I wanted to say to you, Pam. I have boys who are not circumcised. I think it's important to tell them before they start school, like I have a kid in the 2nd grade now, to tell them before they start school that other boys are circumcised, so they're going to look different when they go to the little boys' room, but it's no big deal. That's what and my 2nd grader will come back and tell me, well, you know, they're the little short ones, and I say, it's okay. It's many differences in this world. We're going to go to break. We have Stephen on the line. How are you?
Hi, fine.
Okay. You want to weigh in on this circumcision decision?
Sure. Well, I'm 74, and I've been in the service 3 years, and not one that I heard anybody had a problem with their penis. So on that, it's there for a purpose. It's not there. It's to keep the health reason. You got to wash every day, and that same thing would be little girls and washing up. People don't get washed up and whatnot. You could expect germs. But I never had no trouble. I have brothers that were never circumcised. Not one ever had any trouble. And another thing, how come the animals, they all got sleeves? And you don't hear them getting circumcised, do you? It's a fantasy somebody started, and they go through with it. But I'm 74, and I don't have no problems at all. Never did, and I hope not to.
Okay, Stephen.
As long as you keep it clean.
Okay, we appreciate your input.
I'm sorry, I was confused. That man was uncircumcised.
He's uncircumcised, and his brothers were uncircumcised, and he says, as far as hygiene, well, you practice useful hygiene.
Yeah, I mean, because this tradition of circumcision in America started about over 100 years ago, and again, it started up with the fact that for hygienic purposes, and you're assuming that a guy cannot clean himself, so you cut off his foreskin, he's automatically dirty of some kind.
Right.
And these are fallacies that have built up over time.
Right, and assume a cultural force.
Totally.
When large percentages of the population are circumcised and you want to look like daddy,
absolutely,
it sort of perpetuates.
Absolutely.
Yeah. We're going to go back to the phones. We have Jessica on the line. How are you?
I'm fine, thanks. How are you?
Okay.
I was just wondering, you know, the whole logical reasoning behind all of this. I'm not a spiritual person. I have friends of all different religions, and married, not married, kids, no kids, lots of kids in my family. I don't have any children. But I was just wondering, you know, I could possibly get skin cancer on my earlobes, but my parents didn't have my earlobes removed at birth. On the off chance that I may get a little bit of skin cancer there. And wouldn't it make more sense to say remove the boy's appendix when he's born? You don't really need that, but it could certainly kill you if something ever went wrong with it. I mean, it just seems a little bit like, it's not really worth the preventative measure. It's something you're born with. How can something that you're born with be inherently wrong? You know, women have yeast infections, but we don't have our vaginas sealed up.
Right, right. Well, female circumcision, some of it is that. But
well,
unfortunately, you know,
it's really
I've read all these stories about doctors who have to undo female circumcisions.
Right.
But your point is well taken, Jessica, which is why do a preventive measure if it is not a question of religious faith when what it prevents is a relatively low occurrence?
Right, and I have no objection to that. This, for non-Jews, the issue is predominantly cultural. And Shelton and I were talking earlier that, you know, there are similar things. One of the things you can look at that's also cultural is you can look at the different incidences of cesarean section, both in the United States and outside the United States. There are parts of the world where women who are in the classes where they can afford it have cesarean sections regardless of reason or indication for status, and because they don't want to get, quote, stretched out, unquote, and feel that this will maintain their, and feel that having cesarean section maintains their ability to you know,
sexual relations.
Be attractive, so to speak. Okay, well, there we go. This is where medicine intersects with culture, of course.
Right.
We are going to go to break. As we go to break, we want to ask you, viewers, did you have your son circumcised? Why'd you do it? Give us a call. We'll be right back. We are discussing the circumcision decision. We're going to go right to the phones. Our first caller is Jennifer. How are you? Jennifer? Oh, we'll go to Patricia. How are you, Patricia?
Fine, thank you.
And your point of view in all this?
Okay. Well, I've kind of had one of each situation. My first son is going to be 4 years old soon, and it was kind of just given that we were going to have him circumcised. He was premature, so they couldn't perform it when he was born, and they had to wait until he was 6 weeks old. Now, I have totally regretted it ever since we had it done. The amount of pain that this poor baby went through was just unbelievable. And when I hear people say, well, babies, they get over the pain, or it's not so bad, or they cry all the time, if that was the case, then a grown man who has it done wouldn't need to be put to sleep, you know, or have a spinal block or what have you. And this time around, I'm expecting another boy, and we have completely decided against it. And we've had people actually tell us that we're wrong.
Yeah, people get very heated about this topic, don't they? Really?
Exactly. And when I bring that up, that usually quiets them down.
Yeah.
And that's their main thing. Babies don't feel pain like we do.
No circumcision, no circumcision. This is a human rights issue, and that we have our normal body parts. We should keep them, and with all due respect to the gentleman here, that there are many people, again, who have many faiths, a Muslim, Jewish, who are reconsidering this procedure and saying, look, we've done many things in the past, like animal sacrifice and stoning of women. Circumcision is something that we should reconsider as well.
Okay, we're going to go to break. We'll be back to wrap up. Stick with us. Okay, we want to give you the websites again for making the circumcision decision. First, www.nocirc.org. Secondly, www.aap.org, which is the American Academy of Pediatrics. We're going to take final thoughts here. Dr. Kirsch, you first.
Circumcision for Jews is a religious obligation. Circumcision for non-Jews is a cultural issue as much as a medical issue. There are legitimate arguments on both sides of the choice, and it really is something that parents have a decision to make within their families and within their own cultural context.
Shelton.
Educate yourself as much as possible about the issue. Find out, go to the library, go to the internet, educate yourself about the body, about the anatomy, and make an informed choice. We feel that this is a normal body part. Spare your child the agony and trauma of this, and let him decide when he becomes of age what he wants to do with his own body.
Okay. Don't cut until he's an adult, and he makes the choice himself. Okay, thank you both.